the whole thing about firing the quad is there's a nice research paper that says bicycling is really one of the best ways of training the vastus medialis obliquus, which is this part of the quadricep right there. Typically after any surgical procedure, that just disappears. Poof, it's gone. So that oftentimes becomes a big, we'll say, barometer of quadricep or knee health. So if we see the resumption of that vastus medialis, or your ability to fire it, contract it, use it, that's a positive sign for most people. There's some, we'll say, controversy on maybe what's the most effective way of trying to get that going, but we do know that cycling has been proven as one of the best means of regaining that vastus medialis. You look at any finish line of a bike race, and they have very well defined vastus medialis. So that's just anecdotal evidence right there. But we do know that, and so that's another great reason why bicycling is such an excellent tool for knee rehabilitation. The nice thing about Excy is that with the variable resistance, once you are feeling more confident through the leg, whether it's a healthy knee or a rehabilitating knee, we can create a virtual leg press out of this machine, where we're countering the pressure off this and pushing on our right leg. So leg press motion, pressing motion is quadriceps and glutes. And so when we get our glutes, you know, cyclists have glute muscles. And so they get that when we're up in this position here, and when we're in this position here, that glute is on a lengthened position. And so its job is to extend the hip in conjunction with the quadricep. So that's where our good postures and positions will help. If we're in a good position and posture through the trunk, and then we get that nice push down through, that's quadricep and glutes, and that's a great strength exercise. When we think about the cycling motion, the thing you have to do in order to get a stable leg press into, say, a pedal, is the calf also, foot and ankle has to work. Because what's going on is you're creating a rigid, if you bring the foot back up here, the calf and the foot are creating a rigid lever in order for the quad and the glute to push down into the pedal. So it has to work like crazy. You know, the quad and glutes are big muscles, right? So as you're pushing down, that foot's working like crazy to create that force transfer into the pedal. So it has to be just a nice stable object as you're pushing from the quad and the glute. So, you know, obviously quads and glutes get it, but foot and ankle definitely get a strength stimulus.